Welcome to the session. We'll just follow the format. My name is, that we've established before, which seems to work well. My name is Ben Isaac. I'm the Secretary of the IHE Deployment Committee in Australia. We started our deployment group back in, informally perhaps, in sort of 2007 or 8, and we've been doing informal IHE work, and then started to team up with IHE International and went through a process of identifying sponsor organisations, and once we had an appropriate group of sponsor organisations and a management structure, a governance structure, we were able to approach IHE, and we were declared the Australian Deployment Committee. We saw on the board this morning what are IHE's ideas about the key jobs of the deployment committees, and it'll be interesting to perhaps get views from the audience during the session about whether there are other activities that come under the deployment committee sort of function, and to talk about how people where different groups feel that they've done things well, and things that have helped their success, and also to hear about problems that have made it difficult, and particularly if they've overcome those. So that's myself, and we'll move down the panel, and then we'll move into the questions.
Okay. Yes, my name is Nicky Hekster. I am the vendor co-chair of IHE Netherlands. IHE Netherlands was founded in 2004 and currently counts 100 members, 1/3 of them from the clinical practice, governance, professional society, and 2/3 of industries. So we are already existing for a couple of years, our 10th year this year. But it took us a lot of effort to reach the point where we are today. And yeah, I have supporting slides to answer the questions or position some of the things we are going to discuss now. How can you make an IHE organization successful? It depends, of course, on a lot of things, not in the last place of the country you are operating in, political, economical, and social circumstances, let alone legislation. But there are some, I think, general remarks to be made to make it into a successful enterprise. So I am heading this organization almost for 3.5 years. My user co-chair is a radiologist who was there from the very start, and we have quite a professional organization, because what I noticed that over time, when we grew, we were successful. You have to professionalize a lot of things. So if you do this only on a voluntary basis, it goes for too much time. So from the start, we had a professional secretariat. We now have a technical manager. She works 2 days for us, 3 days for an institute called NICTIS, the National ICT Institute in the Netherlands, which is responsible for standardization, quality, infrastructure. But this helps us a lot to promote IHE and to hand off some of the more technical tasks maybe, and trains to someone who's dedicated on a professional basis. Okay, let me leave it here and give the word to my colleague on the panel.
I'm Chris Carr from RSNA and IHE USA, as well as IHE International. And so I kind of joked last night with respect to IHE USA that we didn't realize when we were IHE USA until IHE Europe formed, and we noticed that there was a kind of local dimension to our activities as well. And we were kind of slow to, that realization was pretty slow to dawn on us, really, or you know, I think there was a bit of inertia toward forming a national group and really looking at the local issues in the U.S. around interoperability as distinct from general global generalizable issues. So it took some time in formation. I would say that we are kind of midway toward the more refined model that a group like IHE Netherlands has, where they professionalize their staff, in the sense that the staff time that supports IHE USA is contributed by two sponsoring organizations, HIMSS and RSNA. They're, as you know, we're professional society staff, so in a sense, we're professional conveners of organizations, so it's kind of a natural role for us. And there is, of course, an advantage in having our labor contributed by our organizations to the organization IHE USA. But I think there's also a disadvantage in that no one has really fully committed time for IHE USA. So that's something we're looking at in terms of the evolution of the organization. So, you know, our challenges, some of the challenges are internal in terms of defining a membership model, which we really have done only fairly recently. IHE USA has a board, an appointed board, but it has really only a few members, and the membership model for IHE USA is just kind of emerging. So there's internal organizational issues, and then the external outreach and communication issues. So obviously one of the critical things that our National Employment Committee is concerned with is the relationship, is asserting IHE's relevance, IHE's importance in the context of the U.S. National Health IT Program. ONC is the organization within the United States Department of Health and Human Services that oversees the Meaningful Use Program that I'm sure many of you have heard of, the incentive program for implementing health IT. And emphasizing the importance of interoperability within that and promoting the IHE implementation of standards that enables interoperability in that kind of proven track record, the process we have, is one of the challenges that we've spent a fair amount of time pursuing for the past couple of years. And it's in part a marketing challenge, we could say, but really it's a very targeted and also kind of an advocacy, or it's a bit of a political problem. It's making the right connections, getting a seat at the table, and those kinds of things consume a surprising amount of energy and have their frustrations, and you know, also quite important. Things are being decided that will have an impact on the U.S. market for some time to come, and IHE USA has been putting a lot of effort into, I'd say, lobbying to make sure that what we do is well represented.
Hi, my name is Sung-Yu Lee. I'm representing IHE Korea, co-chair of IHE Korea. IHE Korea started around 2004 in radiology domain. However, the activity of IHE Korea was very low, and we didn't do much for 4 or 5 years. And we restarted 2010 and officially approved by IHE International March of 2010. We started having connectathons every year since 2010. So we will have 4th connectathon this July. However, IHE Korea connectathon doesn't grow fast because of not much recognition inside Korea. So we are trying very hard to be aware by Korean government and also health IT stakeholders inside Korea. Since in my opinion, since we don't have enough driving force to use IHE profiles or standards or interoperability inside Korea, that's why doesn't go as fast as like IHE USA, IHE North America, or IHE Europe kind of thing. So that's what we are facing now.
Thank you. Moving on to the first of our topics, key factors for success. And I think, just reflecting on the remarks of my colleagues, the sort of issues that came up were about internal management of the organisation, how do we select our members, then we're dealing with relationships, about the multiple, who are the groups that we have to relate with to be effective and to ensure that the other objectives, the main objectives of IHE are then followed. And then lastly, there's activities around the implementation of profiles and also the supporting events like showcases and so on. So that's a sort of framework that seems to have emerged in terms of what are the things that are relevant to the work. So we'll just quickly go back through the group about factors for success. And the second topic, so that we can keep them separated, is branding. And we've had some discussion about branding already in the marketing area, but we may move to that towards the end. So in terms of factors for success, I would be loath to declare IHE Australia a success, but we have been hanging in there now for 5 or 6 years. We've held 7 or 8 showcases, I think 5 connectathons, and we have got our national program to accept the IHE XDS profile and that model of healthcare exchange. So we have achieved a fair bit there, but on the other hand, we're still a pretty small group. We tend to have a membership base that is basically any member of IHE International who operates in the Australian domain, we regard as being a potential member. So we don't charge people to be members or even sort of have them necessarily identified other than through participation, which has its pros and cons. It does mean that we struggle financially because our source of income is primarily profit or surplus from events. And I suppose many of us know how hard it is to actually make when you try to keep costs down, particularly when vendors are quite poor and so on. So that's financial viability is an issue for us, and also in terms of relationships, probably our biggest failing has been we have not really been able to establish a close relationship with the federal government or the body that they've appointed to be the directors of the healthcare program in Australia, NETA. To some extent, and we can reflect on that, but there's many reasons why these relationships are hard, but NETA essentially wants to run the show themselves and effectively make their own profiles and so on, and so we're somewhat perhaps seen as a thorn in their side, despite the fact that IHE has come up with the profiles that they were eventually decided to adopt, maybe somewhat reluctantly. So it's, but on the other hand, we have quite a good relationship with our core sponsors. Now, our sponsors are the HIMSS equivalent in Australia, the HIC, the Health Informatics Society, IHE, the radiology professional body, the College of Radiologists, the Medical Software Industry Association, and Vince McCauley is the chair, was a former chair of that group, and Simon now works for it as a advocacy officer, technical expert, and lastly, HL7 Australia is a sponsor. So we've been successful in getting a seat at the table at the National Health Standards Group. So IHE is recognised in our standards community as a significant player, but the challenges for us are about how to get profiles more widely adopted. So, for example, radiology scheduled workflow should be an obvious profile that we should be adopting in Australia, but we have trouble getting the radiology vendors to sort of market that and promote it in the context of how they want to do business. So understanding those sort of factors are issues for us. So overall, we have to go back from this meeting and have a think about our strategic plan. What are we going to do to improve the way we operate? How do we move? We haven't managed to move from a volunteer type organisation, apart from we have a conference manager, executive manager who's paid a very small sum of money for the work they do. He's a paid volunteer. So how do we move from that volunteer activity, which I think everybody accepts is not sustainable, but does require a budget. So I'm certainly hoping to get some answers from the rest of you.
The floor. I would like to start speaking for IHE Austria. First, I say to you a factor of, not a factor of success, because in the first we had the idea to make working groups for this or that topic. We even thought on mirror groups to ITI, mirror groups to radiology and so on. But after a while, let's say 1 or 2 years, we experienced that we couldn't populate these working groups with people. They simply didn't come. They came to the first meeting or to the second and then they disappeared. So all these working groups were kind of, some did produce a result, but it was, we saw that's not a key factor of success. But now to the factors of our success. The first is, and this is very important, we have a very broad board. We have 6 board members, plus 3 associated members, so it's 9 persons. That's good because we have 9 persons doing some work. Because we also have learned that our members don't do work. As said, they don't come to working groups. But we have 9 people on the board doing some work. And those 9 people are, let's say, political or strategically important. We have the National Health Record organization in the board, the social insurance in the board, the Chamber of Doctors, the delegate is also associated members. We have 2 persons from hospital provider chains. We have the Economic Association of Austria. In fact, in two ways, one for the small and medium organizations, one for the big. And the success of that is we have a lot of communication channels, that's the first. And the second is those people attract people to become member because they think if they have such a political board, you have to be a member of that organization. So that was very important. And the second success, factor of success was that since we abandoned the working groups, we thought, okay, what is now the benefit to our members? Because we have to give something back for the membership fee. And so we concentrated on marketing activities. And we make, for example, one IHE day, which is totally dedicated to IHE. It's a standalone event. It's not aligned to something else. And the funny thing is, on this IHE day, we try not to speak so much about IHE. What we try to do is to get speakers which are strategic important. For example, at the last event we had the owner of one of the largest laboratory chains. We had the owner of the largest radiology chains in Austria. And that attracted an audience of more than 100 people to this event. And besides of these VIP speakers, of course, we placed the IHE message and we could generate a very successful event which attracts people to the next event too. That is the first, that's the IHE day. The second is we make a second event which is half day, and this one is dedicated just to our members. On this event we have really specific talking about IHE. Yes, we have developed some concepts in details. For example, to bring people to the World Summit was quite a success. We would like to share this template, how we did it. In fact, we have already shared. But some things like this we are glad to share with you if you are interested.
So comments from other deployment groups about things that have gone well, things that you think are different to how others are doing it?
IHE Japan. We've been doing it for more than 10 years. And one time, one very strong American company have not been participating in Japan Connect Zone over South Africa because they already passed in the United States, the North America. I, as a vice chair of IHE Japan, promoted IHE Japan Connect Zone, past, certified companies, department heads, please, buy among these companies to promote IHE Japan Connect Zone. And that made the companies, Japan, very angry because they passed in North America. And also one company was complaining that Japan Connect Zone requires a multi-byte character handling. Of course, our ministry requires us to use our 2-byte characters. So another company complained about HL7 versions, 2.3 versus 2.5 program. So making this, these kind of programs make our IHE Japan Connect Zone's trust a little bit distracted. People say that they say they passed the Connect Zone to the customers. They say to the customers, the vendor say to the customers. And at the place, there was an additional charge was claimed to the hospital because of the some alterations to conform to Japanese settings. So why you are doing the Japanese Connect Zone? On what basis you are doing that? So we are a little bit kind of thinking of changing our policy to go to some kind of a certificates or the project zone kind of things, which is entry it can be done by the connector zone past companies. Could be anywhere, North America, could be Japan, could be Europe. That's another kind of things that we think for the future.
I think this issue of dealing with the vendors obviously is something that is critical, and certainly we've made mistakes in dealing with vendors. The vendors are very sensitive, and sometimes a carelessly said word from a podium or recognising a vendor as an example is enough to really upset other vendors, and so I would imagine that's probably an issue that that is affecting everybody about sensitivities, but certainly we do get in Australia the same issue. Vendors say, well, we've been to North America or we played in the showcase elsewhere, and while I think the reasons why they should do it locally are perhaps obvious, it in many ways reflects the fact that often our local vendors, the local people don't understand IHE. They don't understand the difference between a showcase and Hackathon, and they're somewhat removed from their central organisations, which may be very supportive of IHE, but as a local profit centre, business centre, their focus is on other issues. But so other comments about issues which make your deployment group successful? Yeah.
Yeah, because we also, in the Netherlands, we always are participating at a large exhibition called Healthcare and ICT. And in the past we have done interoperability demonstrations. And the companies that would or participated at the time, we required them to show that they were able to show some integration statements done at a European or North American connectathon. So we respected the connectathons that were actually being organized around the world. But we did our little mini connectathon to be absolutely sure that things would work before going to the floor of the exhibition. So that's a little bit a twist in doing connectathons. That's also becoming very difficult because these companies have matured over time and are very busy also promoting their stuff outside this small country called the Netherlands. We have Dutch companies that are active abroad, a lot of them actually, but also companies like Siemens or GE Healthcare that are active, of course, around the world. They don't have the time to do this. So, but we have to respect these industries and the commercial vendors. We'd like to have them on board, but we were not so strict at the beginning with connecting those. But in the end, they will go to the North America, they will go to the Europe, and that's enough for us. At least if they show that they can connect before going to a floor of an exhibition.
In Switzerland, we started with a sound financial basis. I think this is a key factor. But now we are increasingly facing the problem that at the beginning, international companies committed to work with us. Now they quit because they say, we already pay IHE International or in the US. I don't see why I have to pay a membership fee in Switzerland as well. I think this could be a problem in our local communities too. How do we face that problem?
First of all, can we clarify? I don't think it actually costs anything for companies to be a member of IHE International. Can I be corrected on that if that's not right? Yes. So, in fact, the issue then becomes if you charge locally, you're charging to be a member of IHE in Austria or Switzerland or Australia, whereas they don't have to pay to be a member of IHE International. And the support for IHE International comes from a range of areas, but IHE International is heavily supported by its sponsor groups. I think Chris alluded to the fact that some of his IHE work is covered by his employer, the RSNA. HIMS provide staff to run IHE. So
but I recognize the concern of Jürgen because if you are in Europe, you maybe want to be a member of IHE Europe and you have to pay a fee.
So IHE Europe has a fee,
yes.
And IHE Netherlands also has.
Yes, IHE Netherlands also has a fee, and what we see that some companies are backing up and say, okay, we want to be a personal member because we make a difference between a corporate membership and a private membership. The first one would cost 2,500 euros, and the other one only 500 euros. And there are companies that say, okay, I'm now a member of IHE Europe. I stay in touch with the local organization, but only on a private or personal basis. And that's for that, that's enough. And 500 euros is not too high a price to be in touch with the local organization. It gives you some rights. You are entitled to send one person to our annual conference, and there is more, whereas you are a corporate member, you can send 3, for instance. You have voting right in the steering committee, which you lose if you back up a little bit. But I see this happening in my country as well. Fortunately, there are still new members, new vendors, new hospitals that are interested in becoming a local member and not directly a member of IHE Europe.
Okay. You should perhaps carry on this discussion in the sense others, find out what experience others have had around membership.
Just wanted to say to that, in Austria the same discussion, but haven't used members yet. But to that, on international level, we have a working group called Financial Sustainability. And this working group has a very difficult task to make a financial model which is suitable for IHE International, but also considers exactly this problem. So it has to be worked out, a sensitive balance, who is charged by whom, how much. So we would really invite you to help us in working this out, because this is very complex. It's just
it's also the other way around. For instance, in my country, Microsoft is not a member of IHE Netherlands, and I would like to have them as a member. They say, well, we are in the US, we are a member, they're very active, you always see them on the HIMS interoperability showcase, but they're not interested in the local market, apparently. So.
Thank you. Yeah, in the UK, it's very similar story. In the past 2 or 3 years, we've seen a number of companies withdraw from IHE UK. They don't see a particular relevance in being a member anymore. In the UK, IHE has quite a lot of brand recognition, but very little adoption from the centre. There was quite a lot that was starting to be a fair amount of adoption from, shall we say, grassroots within the National Health Service, which also leads to another problem in membership, because none of the hospitals in the NHS would join as individual members because they're all part of the NHS. We have finally got the central NHS to join on to be more actively involved in IHE as a member, but that's just a single subscription. So we're faced with both sort of waning revenues and also waning interest in member participation, such that for the past 8, 9, 10 years we've run demonstrations at healthcare events. Last year we didn't run a demonstration because with demo fatigue it was impossible to drum up enough interest for people to take part in that. The interesting thing was that instead of having a larger stand at these events with a demonstration that we walking people through, we've had small booths at several shows, and in fact we've had more people come and visit those small booths in the last year than previously, when we had shared a larger stand and we could more people through. So the brand recognition is there. The adoption is happening, but the actual involvement or the interest in being involved actively in IHE as an organisation is definitely tailing off, because I think a lot of organisations are saying, okay, it's there, we know how it works, we've done that, or we're doing that elsewhere in another country, therefore there's no point in us being involved in a national committee. It's a big issue we have to face.
The members of the group feel like they've got a solution to that, because in terms of new products, new ways of engaging with organisations locally to actually be participants, because if they're not prepared to be involved, then they're not going to be serving on committees or doing any volunteer work. So are there any groups that have turned the tide there, or feel that they've developed new products or approaches that appeal to members? Second is around IHE branding in the national and regional context. I suppose that comes on the tail of that last discussion, where certainly in Australia we promote ourselves as the Australian Committee of IHE International, and to the point, as I said, when if you're a member of IHE International, then we're regarded as a member. But the getting recognition locally is challenging, and particularly when we don't have a lot of IHE deployments as such, and even our flagship deployment, the national program, someone hides it, as we discussed earlier. It's buried underneath the covers, and certainly it's not being promoted by our national program, because they don't particularly want to. We have a sense they don't want to give IHE a leg up, as we're seeing as competitors to them. Well, you can certainly might, or that they would become in some way controlled by us. So branding at the national level, perhaps ask for our current panel members to make a comment, and then to the audience.
Yeah, I recognize it also, but I totally agree also with the remarks of Chris, which he made before, that you should think over very strategically and tactically who you want to involve in IHE. So in the Netherlands, it's a small country, so linking and lobbying is maybe somewhat easier than in other countries. But we are very well involved with the Ministry of Healthcare, with medical professional societies, as Jürgen also pointed out, how they do things in Austria. And we are working together with the relevant standardization organization, development organization, like HL7, like DICOM, like IHT, SDO, the guys who are responsible for SNOMED, because we are all aiming at similar goals, and what we also do is having reciprocity membership. So I can go to HL7 meetings, they come to us, and there's another organization which is a convergence of all vendors in ICT healthcare that have a separate organization, more a lobbying group that aims at the minister. But I'm also a member there, so this is very easy to communicate and get things done together because we are not there alone. IHE is not unique in that sense. So that's I think an important observation. And besides from that, you have to make a lot of noise. You have to have a website, you have to go to conferences, you have to promote this always. So marketing, I think, is key. And it takes a long time to get at a point where you really can influence things, how things are going in the future. So, okay, let me stop here and maybe give Chris the word.
So, yeah, I started, in my initial comments, I think I kind of led with my chin in terms of the challenges that IHE USA faces, but I would say that there are some things that IHE USA has done quite well, and the whole model of connecting the testing, the interoperability testing, really our performance testing activity, with significant public forums has really worked, I think, very well. We can talk about whether any level of marketing is sufficient or is reaching the appropriate people or is telling the story the right way. Dissatisfaction with marketing is kind of endemic. I think I read somewhere that marketing executives are the most frequently replaced members of organizations. It's just in the nature of things that people are dissatisfied with the level of communication that organizations have. I think we've done pretty well in the U.S. in that the stakeholders in the U.S. tend to know what IHE is. There are certainly those, view it as competition. And there is the same kind of resistance to, things not invented here, is the phrase used in the U.S., among certain organizations, governmental organizations typically, that we struggle against. But those people know who we are, and I think, the advantage we have is we can kind of win a war of attrition against most of these, particularly government entities who their initiatives tend to be transitory and come and go. IHE has, kind of had the stake in the ground for a long time, has a well-established process, and they tend in the end to come back to us because we have the technical foundation, the implementable specification. But I think just where I started in terms of branding, that basic model of giving vendors this dual incentive to participate. On the one hand, facilitating their adoption of a shared framework for interoperability, so that, the technical foundation of the Connectathon. And on the other hand, the marketing platform that's offered by events, the HIMSS Interoperability Showcase demonstrations at the RSNA annual meeting, the American College of Cardiology, American Pathologists, other groups have done IHE demonstrations and education events. I think that's been pretty effective. And in terms of really reaching our general target market, this is, aside from the kind of politicking and lobbying involved in the outreach process, reaching the general market and creating general awareness, I think that's a pretty effective model, relatively speaking.
In Korea, we also work very close with HL7 Korea and also ISO TC215 members and Korean Standards Development Agency. So actually, we have HL7 Korea chair involved in IHE Korea Connectathon and also ISO TC215 national delegates involved in IHE Korea Connectathon. That's how we branding IHE Korea. And we don't have national projects about health information exchange. However, we have small projects health information exchange. In those products, we ask them to require or recommend to attend a connectathon, so to test those systems produced by those products. And maybe later on, we can ask them to use IHE certified systems. That's how we are doing and what we are planning.
So over to the group about success stories or issues around branding and you know, how do we establish ourselves in the marketplace. And we seem to be what we are and to represent the core values of IHE, which I think we're all here because we were probably all initially very impressed with IHE when we first were exposed to it and to the extent of becoming involved.
I want to put forward a controversial suggestion. IHE asserts IP over all of its profiles. To be a member of IHE, you have to agree to assign your IP rights to those products to IHE.
No.
Is that not how you compare?
No, this is not correct.
Okay. What is the situation with IHE?
I can speak to it. So the copyright of all the IHE technical documents is open, is free for distribution through it works. There's no restraint, and it's open to IHE members or anyone else who wishes to use it. The only IP right you agree to, or the only IP restriction you agree to when you become an IHE member is the duty to disclose relevant patents. So member organizations who are engaged in development activity in IHE have the requirement of disclosing known patents, known to the person involved in the activity, that are relevant to the material they're working on. That's the extent of the restriction.
Most understanding free, it might be a copyright. But my suggestion was, should we be charging national programs for using IHE profiles?
Okay, controversial. We've heard that IHE is under the covers of many of our national programs and often not recognised. So should IHE be insisting that those sorts of programs are paid to use it?
I wasn't going to respond to that question. If somebody would like to take that first.
Okay. Charles?
Yeah. The answer is, if we would do that, we would prevent the second from happening. It is by viral knowledge and understanding of the profile, people that are familiar with them, they try to implement them, and they have gone to Connectathon, that this creates the comfort level that a national program needs to actually mandate or require or use the IHE profile in their program. So I think we really need to encircle the national programs as much as we can, because those are political animals, and political animals only react to political situation. And I think this is still the best. This being said, we need to be clever. There is a lot of value add in the IHE process, especially the testing tool and the testing plans. And this is one of the things that IHE Services is now doing, which is to sit in the national program. Oh, by the way, you need to do testing. We're going to help you with the test tool. We're going to reduce your cost of developing your own test tool by reusing the IHE tools, which now makes a revenue to not only improve the tool, but also support the national program to use them and give them an incentive to take even more profile, because those are well supported with good tools, and make the vendor happier because the same tool are used in many places where they need to test. So that's again the idea of, yes, we charge for a service. Vendor, you need to pay to come to Connectathon. This is fair. You get direct service delivered to you. Vendors, if you want to do testing in-house, the platform is open source, but if you need help, we'll give you help. We're not going to make money on the help, but we we're going to charge you for the help we can give you. Same thing for the national program. That's kind of the model which is emerging. Please tell us whether this is a reasonable balance between getting the necessary revenue versus keeping maximum openness and flexibility.
Can I just add one thing? Just from the financial sustainability, someone raised an issue earlier about the fact that IHE International requires a certain amount of resources to run, and we're examining sources for revenue, and the whole problems that we alluded to here of any imposing additional costs likely to suppress activity, avoiding that. There are really three models of potential revenue. One of them being licensing of intellectual property. That was the least favored option. What Charles is talking about in terms of diversification of testing services is something that really is at the national deployment level, primarily in terms of generating revenue. But I'll just throw out, I don't know if this is as controversial as yours is, but one of the recommendations of the the direction that I think the financial sustainability work group is moving toward is proposing some kind of connect-a-thon tax, some percent of gross revenue or net revenue from connect-a-thons to fund the development activities. And the development being the committee work and publication and textual governments. So that's one. The other is a membership model, and I think we heard some of the objections to that in conflict with existing memberships and so forth. But, so throw that out. We can have further discussion here or after the session.
So going back to a couple of comments before Canada, I just wanted to sort of give you more information about the Canadian implementation of IHE in Canada. So to Charles's point about encircling the National Deployment Committee, we've done that. Members join the Invoice Standards Collaborative, pay a fee to do so, and enjoy all the benefits of the Standards Collaborative, including IHE Canada, access to all aspects of IHE, but also HL7, IHT, SDO, and TC215. So that is a sort of a one membership model, and that seems to work very well for Canada. On the topic of branding of IHE, we've also been very successful in Canada in maintaining the IHE brand. We have this thing called Canada Approved Standards, CAS, and I'm pleased to say that XDSI is a declared Canada Approved Standard. We maintain the name XDSI, the recognition of IHE, it goes with that, and so does the value of all the testing of the Connect Fund, etc. We also have one other variation, that we have other standards around compliant identity management, and we have initiated a project in IHE to develop PICS and PDQ for HL7V3 with the express intent, and these have been successful profiles that have been developed, but in Canada, it's been a tremendous asset to us because we have in fact paralleled our client registry specifications in the PICS and PDQ V3 profiles, where in fact vendors can conform to Canada's specifications for client registry by supporting the PICS and PDQ V3 profile. So those are examples. We have no intent in Canada to mask any of the value of branding of IHE.
So do we have any other comments about branding? And if we don't, we might just go back to the first issue that Chris has raised, which I suppose is, so we'll ask about that branding first. Any other comments on the branding issue in terms of what has worked and what hasn't?
When you have those Canadian approved
So it
standards,
is the microphone. Yeah, the podium.
with those Canadian approved standards, do you have to republish them, or do they accept IHE's publication mechanism?
Complete referential publication, so we just pass it through to the IHE specification for XDS.
Okay. So if there are other branding issues, then we've got a few minutes left. We might just go back to this issue of financial sustainability. if I understand this correctly, IHE International is looking at how it remains financially viable and what sources of income can be used to support things that underpin the process, like the toolkits and staff recognising that not everything can be provided by sponsors, particularly once you get into an international environment and you've got US-based sponsoring organisations who presumably would like to be seeing that their sponsorship is going towards a fair percentage of US activities, so that sometimes the move from being a US-based organisation to an international one sometimes opens these questions about who pays and who benefits. But I suppose talking about connect-on taxes, IHE's, not all affiliates actually have connect-ons, but certainly the ones we run in Australia have been quite relatively small, with maybe 10 or 15 vendors, perhaps at the most. We're often forced to charge fees which are really tiered against the organisation level. So we have a sort of large vendor, medium vendor, small vendor. But we of course find some of the vendors banding that around the edges, saying, oh well, in Australia we're only a small vendor, we only have 2 or 3 people or 10 people. So there might be an international organisation of thousands, but essentially but in order to get people to play, we have to somewhat be flexible. And so we're very lucky to do much better than break even. Our best success financially has been around value-added activities. We ran a connectathon for the Australian government when they were forced into a situation where they declared that if GPs didn't implement a certain not yet finished or tested standard for messaging, really a competitor to the Australian equivalent of XDR, web service point-to-point messaging. Australia, in its wisdom, decided to create its own version of that, which is very close in many ways. But so IHE Australia set up first of all, an event where the first part of the week was about a project-a-thon, getting vendors trained and cutting code and so on. And then the second part of the week was actually an IHE-style connectathon using IHE rigorous methodology to actually test what was in fact a local communication profile. It was doing an event. That event raised us sufficient money to then underpin our next couple of connectathons and showcases. But essentially, I think we'd be straight even if you took 50% of what we earn. Our budgets are in the order of between $50,000 or $60,000 for events, and certainly. If you took 10% of that, we would probably, in most cases, not break even ourselves. But over to the rest of
A small comment to that. We are fortunate in my country that we are interlocking with the National Organization for Healthcare ICT, and they are sponsoring us not by financial means, but in sponsoring in kind. Because when it comes to localization and writing national extensions to profiles, then we need these organizations, and they are willing to do that on behalf of us or together with us. So it doesn't have to be necessarily a financial underpinning of your operations, but it could also be an in-kind support.
Of course, in-kind support is hard to tax. Any comments about the capacity or likelihood of being able to contribute to IHE international coffers? No. Okay. So, any comments from the group as a whole about what is it that we can do as international affiliates to support the mother organisation, so to speak? And I don't want to downplay the support. We've had fantastic support from people like Eric Rousseau in terms of helping us set up gazelle instances for our connectathons. I mean, you couldn't run the connectathon without it. And Bill Majorski and some of the technical team on helping our vendors get to do the pre-connectathon testing. The email channels run hot, and so there's no doubt that we could not do any of the things we're doing without that support. The question is how can we in some way feed back into that? So I'll perhaps open up before to that question. What is it that we can do to help the main international organisation that we're deployment organisations of?
or to open their pocketbook.
No,
I don't know.
Buy more T-shirts.
Here,
Speaking
buy more
now
tickets.
as a national initiative, I don't know how we can help in this, but I can tell you what the national initiatives would like to have from IHE International. We as a national initiative have all hands full to do to go to our local people promoting IHE, providing marketing material and educational material and this material and that material is an additional effort which from our perspective should be done by IHE International. Because this is brand marketing, and brand marketing should be done on the top level and provided to all the others. Because then the initiative can be more efficient in that what actually they have to do. They have to approach people, they have to talk to people, they have to create events and so on. So this is definitely something which would help us as a national initiative.
Right, so we turn the tables about what is it we would value as a service if we could get it from IHE International, and certainly supporting marketing is would be something we would find in Australia helpful. And we would probably in Australia find having access to the website in the sense that running a website is really somewhat beyond us. We do have small numbers, we don't have an active webmaster, and so whether we could in fact in some way have a section of IHE website and access to maintain our part of it. We run our own wiki, but certainly the website would be helpful. Communication infrastructure, we have to buy access to GoToMeeting. I mean, I don't know what other organisations use, but it may well be possible that an international subscription to a conferencing product could be amortised across the whole organisation, and it might be provided less expensively than we have to doing it ourselves. Are there other ideas before we wrap up? We've got 2 minutes, so one or two final comments, and then I'll hand back to you again before he turns off my microphone. Okay, anyway, well, let's set the scene for perhaps some discussions on the Bosphorus after a few drinks. You might be able to get us going up that one.
Thank you, and 4.